Well, good afternoon, everyone. It is 12 noon on Friday, September 10th, and we are welcoming you to the Flint Community Webinar on Coronavirus. Believe it or not, we are here at week 78, and we are excited that we, the Healthy Flint Research Coordinating Center, along with the Flint Center for Health Equity Solutions and the Prevention Research Center, are able to bring this webinar to you. Remembering what we said every week, we're working to bring you information that's relevant and current, and also to put a local context to what we've come to learn now as a global pandemic. How is our community affected by all the things that are going on? And what can we as a community do with the resources that we have? How can we best utilize them? I am excited to be able to be here today as your moderator, Yvonne Lewis, as one of the co-directors of the Healthy Flint Research Coordinating Center, which is an amazing partnership that's designed with community and academic partners to bring this relevant information to you. We could not do this without the support of this amazing group of organizations that have joined us for these weeks. And I would take me a long time to go through all of the partners that are here today, but I just want to say thank you from the Genesee County Health Department to our hospital systems, Hamilton Community Health Working as well, our MTA, the Genesee Community Foundation of Greater Flint. I'll just name a few today. Genesee Health System, they are here to continue to ask questions, answer questions for you as panelists, along with the Genesee Health Plan, our partners from Michigan State, University of Michigan, as well as the Genesee Intermediate School District is on today. We really want to encourage you to ask those questions, put them in the Q&A as we go forward in this session today. If you are listening to us because you're joining us by Facebook, or you may join us by YouTube, and you may have some questions, feel free to give us a call at 810-835-2130. Again, that number is 810-835-2130. Or you can send that question in to info@hfrcc.org. We do want to hear from you today. On this Friday, September the 10th, we have an amazing session for you. We're going to hear an update from the Genesee Intermediate School District. We also want to spend some time with learning, what are we going to do for our children, the children's mental health trends. Katie Baxter is going to be here to share with us about that. We'll get an update again from the Genesee County Health Department, and we have an update from the city. We want to make sure that we're addressing the issues that are most relevant to you in our community, so that you can then share this information with community members who may not have an opportunity to join us today. So we want to move right in today and start our conversation. We'd like to welcome Tricia Hill, who is the Deputy Superintendent of the Genesee Intermediate School District. There have been a lot of questions, Tricia, about what's happening in the district. So I know you've got some really important things you want to share with us. So welcome, Tricia. We're glad to have you back today.
Thank you so much. Thank you for having me. And I know it can be quite confusing for parents and guardians because different schools may be doing different things. So I wanted to just start out by explaining a little bit about our structure in Genesee County and the role of the Genesee Intermediate School District. So before you on the screen, you'll see that these are the programs that the Genesee Intermediate School District directly operates and are governed by our Board of Education here at the GISD. So we have our special education, our center-based programs and buildings. I'm sure these facilities are very familiar to you all. Elmer Knopf Learning Center, Marion Krause Instructional Center, Early Childhood Programs and Services, and then our Transition Center. We also operate the Genesee Career Institute, so our career tech high school in the county. And we operate 2 early colleges, one on the campus of Mott Middle College and one on the campus of Genesee Early College. And then we also operate several early childhood programs throughout our county. We operate Early Head Start in Flint, multiple sites there, multiple sites for Head Start throughout Beecher, Carmen, and Flint. And then we operate GSRP throughout Genesee County, and those classrooms are mainly housed in our local school districts. So then if you look at the support that we provide to the county, the Genesee Intermediate School District is considered a service agency. And we provide support and resources to the 21 local school districts and the 14 public school academies within Genesee County. But it's important to note that each of those local school districts and public school academies, they are each governed by their own board. And that board will set their policies and their procedures for their schools. So the GISD doesn't necessarily govern the local school districts and public school academies. We provide resources and support. I just think that's important because I know we have been getting a few calls here, and I know Yvonne has mentioned there's been some questions from parents, which perfectly makes sense. Why aren't school districts all doing the same things when it comes to decisions around COVID-19? And unless there is an executive order put out by the Genesee County Health Department, that gives each local school district the ability to make their own decisions if there is not that executive order in place. So I know a few weeks ago, some school districts said, okay, we're going to do mass K-6 or maybe K-12 before that order. And they absolutely had the right to do that. And they each do that, make their own decisions for what's best for their community and their school district. So that might shed a little bit of light on why sometimes things aren't always consistent from district to district. And my best advice for parents and guardians is to call the school administration office if you have questions. They're certainly willing to talk to you and talk through their decision making. And then you'll find exactly what's expected for your child at the school they attend.
Thank you so much, Tricia. We appreciate you coming on today because, as you said, there have been many, many questions. And of course, we know that all of the children who live in Flint are not necessarily in the Flint community school system. So we wanted to make sure that all of our families had a good understanding about this. I just want you to, if you could, reemphasize, you're an oversight organization that provides resources, but you don't make the decisions for each of those different school districts.
That is absolutely correct. Yep. We provide support and resources to all of our schools in the county, but they each make their own policies and procedures with their own governing boards.
Okay. And are you in touch with the Genesee County Health Department as it relates to some of the policies and procedures that you're seeing and have an understanding about?
Yes, they have been a great partner. We stay in regular communication with weekly meetings. All our local school districts are present and our public school academy leaders, and we meet regularly with the Genesee County Health Department.
Okay. So the beauty of it is that there is some interconnectedness. No one is out here all by themselves. There's a collective conversation that's going on a regular basis.
Absolutely.
Thank you so much, Tricia. And I know you're going to stay. And if there are questions that individuals have more specifically, they can put them in the Q&A and you'll be there to answer them. And then we're going to ask you, following our next presentation, to join us for a quick roundtable. So as we're talking about the issues that are relevant to schools and knowing that different schools are making some different decisions, sometimes that raises questions, even for our children and how they interact. So we're happy to have Katie Baxter to come back to talk with us today about what really is going on. What do we need to think about for our children? And this is an important week even for us to consider. So Katie's going to give us a good presentation and overview with respect to our children's mental health. And Katie is from the Genesee Health System. Thank you, Katie, for being here today.
Thank you, Yvonne, for having me. And thank you so much for allowing us to talk about mental health and encouraging us to talk about mental health for all of us, but particularly today we want to talk about our children. And it has been a very difficult time, 18, 19 months for all of us through the pandemic. And we've noticed that our kids have been one of the populations that have really had a lot of struggles. So today I want to give you some information about what we're seeing, trends we're seeing with children in our community and really across the United States, and then talk about what can we do about some of those concerning trends we're seeing and what are some resources that are available to us. So one of the things you see on your screen is something about anxiety. We are very surprised to see the large number of individuals, youth, who have anxiety disorders. Now, if you see that number 1 in 3, that is a lot. That is a high percentage of children with anxiety disorders. Keep in mind that there is a continuum of severity for anxiety disorders, but to think about all the teens that you know of, 13 to 18, personally in the community, family members, that's a lot of kids that are carrying around a lot of worry and a lot of stress. So it's something that we're aware of, and it's something that there's good treatment for. So it's important that people know that. The next slide. When we look at depression, that is also a very big concern for people of all ages, but particularly children. We're seeing some very concerning trends with children, and this is not just related to the pandemic. When you see the screen, you can see that it's talking about rising depression rates of children ages 12 to 17. Now, when you look at the year 2008, we saw depression rates at about 8%, under 10%. And that was still high enough and not good. But fast forward to the data we get from 2018, before the pandemic, and we see almost double that rate, 14.4%. So that's very concerning that we are seeing this ongoing trend of children really struggling with both anxiety and depression. So it's something that's very important for us to be aware of, that kids have depression too, and anxiety too. The next slide. The other thing that's important to keep in mind is that our youth are often underdiagnosed and undertreated. This is some interesting data about people who have major depressive disorder within the last year. And if you look at the youth compared to the adults, there's a disparity here. Only 41% of ages 12 to 17 years old and 49% of ages 18 to 24 years old have received treatment for major depression or depressive episodes. When you look at adults, 26 and older, about 70% of those individuals have received treatment. So there's a disparity there, not only in the trends increasing for depression, but also the youth not getting the help they need. So it's so important that we know that help's available and we know about the resources. And that's why I'm here to talk to you about this today. The next slide, please. And this is a survey from the Child Mind Institute that talks about the impact of the pandemic on children. And parents who sought help for their children reported a lot of decline. Significant amount of them reported decline in their children's overall health. And these are some numbers that they reported. 72% saw a decline in their child's emotional well-being. That's almost 3/4 of them. 68% in their behavior, and 68% as well in physical health issues related to decreased activities, exercise, and weight gain and things like that, that some adults and children also experienced during the pandemic. Next slide. I want to talk about suicide. Suicide is always tragic, and it's something that is preventable. It's very important that we all realize we all need to take a role in suicide prevention. This could be your neighbor, your church member, your friend, your child. Suicide impacts all of us, and it's very important that we all understand things about suicide and ways to prevent suicide and how to be a positive factor in that prevention aspect. So I want to say suicide, unfortunately, is the second leading cause of death among individuals 10 years old to 24 years old. And yes, we do have 10-year-olds who complete suicide. It's very devastating. So it's very important, and I know these are alarming numbers, but it's important that we're aware of this because it's one of those things, sometimes people don't want to talk about suicide. It's very tragic, and and it's very devastating to families and to communities, but it's important that we do talk about it because there's help for it and we can prevent suicide. It's the second leading cause, second only to accidental death for youth. And rates are on the rise for youth, and they have been on the rise. So this is not new. We see these rates since 2007 have been increasing for youth for suicide. So it's something that we're aware of, and we're working on a number of initiatives to address this. Sadly, more than 50 each year. Now, this isn't just children, this is adults and children, but that's 50 people from our community that die by suicide each year. And each time it has a devastating ripple effect. Suicide affects all ages and backgrounds and racial groups. It's important that we're aware of that. But what we do know is that there are some racial disparities and some differences. So it's important to be aware of that. This slide has a lot of information. So what I'll ask you to draw your attention to is from the years of 1999 to 2019, and it's a trend rate of suicide among male youth ages 15 to 24 by race and ethnicity. Now, what I want you to notice, if you look at the top line for American Indian or Alaska Native youth, male youth, that is very high. So that's an area, a population of individuals who are really impacted by suicide, and you see the high rates and the ongoing trend. Now, when you look at the blue line, that is the total number altogether, and all of the groups together. So when you look at this, you look at the lines together, you see kind of a trend, an upward trend, which we've been seeing in recent years, really since about 2007. But what is interesting and concerning is that when you look at the group, the overall group blue, and particularly the dark green group on top of that, that's non-Hispanic white, when you get to the year 2018, you start to see a decrease. So that's a good thing. We are encouraged by that there's a decrease in suicide rates for that group. However, very concerning is if you look at the dotted lines of the orange dotted line is Black or African American male youth, and then the other dotted line there, like a greenish dotted line, is Hispanic or Latino youth. And so instead of seeing a downward trend there, we're seeing an upward trend. So this is very concerning, and it's important that we're aware of this. So when we're looking at our suicide prevention efforts, that we're targeted to individuals who are most impacted by suicide. So it's important we're aware of that. The next slide. So I want to say, what can we do? I know a lot of this information I provided is not happy information, it's concerning information, and it can be a little alarming to us. But what I want to say is that we are people of hope, and that there is hope. We believe in recovery and wellness and resiliency. So there are a lot of things we can do to prevent suicide, and we can work together to do that. One of the things I want to say is how important it is that we all learn about the warning signs. First of all, not just about suicide, about mental health troubles or problems or challenges, because any kind of healthcare, it's always best that we catch healthcare concerns early. So prevention and what we call early intervention are always the best things. If you think about your medical health, you don't want to wait until it's very, very severe before you get help. You want to get help early on so that you can get prompt treatment and get your healthcare needs taken care of. It's the same thing with mental health. So it's so important that we're all aware of the warning signs. And Genesee Health System for many years has offered psychological first aid and youth mental health first aid. And mental health first aid And there are a lot of different kinds of trainings like this and things for the community that are free for us to learn about how do you help people when they're struggling with a mental health illness. Just like you would want to learn if somebody was choking or having some kind of a medical emergency, how do you do CPR or those kinds of things. These are things we can learn skills so we can all be better equipped to help people when they're having mental health challenges. And please remember that 1 in 5 people experience a mental health condition at some time in their life. That's a lot of us. If we're not experiencing it now, we may in the future. So it's so important. Also, I want to say it's very important to speak up if you're concerned about someone. Sometimes we feel it's not our place or we don't want to say anything, but that's sometimes it requires someone who's outside of the situation to reach out and say, have you thought about getting any help? Or do you know about this resource? Or how are you doing today? Just reaching out to people. Sometimes these small efforts can make a big difference. And all of us can do that. We don't need to be a mental health professional to do those things. Also, I want to say how important it is to reach out to people that you know. We know how much we have all been impacted by the pandemic and how hard that was when we felt we were isolated and we couldn't reach out with people we wanted to be with and hug and touch and all those kinds of things. And all of us have been impacted by that. And sometimes just picking up the phone or doing a video conference or a text or anything, sometimes little things are things that are the encouraging words or support that people need, because relationships are important. And all of us want to feel that people care about us. They want to know how we're doing and that we're not isolated, that we do have help and we have support. So it's so important. Also, I want us to be aware that there are a multitude of resources available, and it's so important to avail ourselves of those resources and to know what they are and to share with other people that might not know anything about these kinds of resources. They may be having a family problem or a challenge with their child, and they don't know that these resources exist. So please learn about them yourself and share them with other people. The next slide. This week, particularly, is National Suicide Prevention Week, September 5th through the 11th, but it really is National Suicide Prevention Month, all of September. So we're really focusing a lot of our efforts, and you'll see information on social media and things, people talking about suicide, how to prevent suicide, and what you can do to be a part of that. So I want to talk about some resources that are available that I hope you'll take advantage of. First of all, I always talk about our 24-hour crisis line, 7 days a week, 365 days of the year. We have our 810-257-3740 number. And keep in mind that is for anyone in the community. Since the pandemic, we've had what we call behavioral health urgent care, and that will continue. It's not just during the pandemic. That is an ongoing service we're going to provide. And this is something wonderful because in times past, I think people thought about community mental health was something, oh, that's not for me, that somebody with some kind of a serious mental health issue, but not for me or my family members. And that's not true. Mental health affects all of us, and our behavioral health urgent care is for all of us. You don't have to have a diagnosed mental health diagnosis in order to receive this service. So please take advantage of that behavioral health urgent care. Counselors are available to talk with you, and it might be a serious issue, or it might be you're just having a really hard time and you need somebody to process that with. So please utilize that. I also want to talk about our crisis text line, and that is so important. We know that teens often will text. They don't want to pick up the phone all the time, but they're quick to send text. So it's important that we share these resources with the teens that we know, and we and make that information available. Text Flint to 741741, and counselors are available to respond and talk to teens, whether, again, it's a very serious issue and they need to get help immediately, or they're just having a rough time and they don't have anybody they feel they can talk to at that time. Sometimes you don't feel you could talk to mom or dad or somebody else. about a problem. And it's better even to talk to somebody who's not that close to that problem. So keep that in mind. I also want to mention our Intensive Child Stabilization Services, ICSS, is a service for families. It doesn't matter what insurance you have, whether Medicaid or private insurance or no insurance. If you have a child and you're having struggles with your child and you just kind of feel at your wit's end and you don't know what to do and you need help, you can call our number. It's the 257-3740 number and ask for ICSS, or just say crisis supports for a parent for children, because that's a service that's available to our whole community in Genesee County. And it may even involve counselors coming out to provide an intervention for your family. So that's available to you. I also want to talk about free evidence-based suicide prevention training. Once before, we did talk about that in this webinar, and I want to remind the community about this resource. It's an evidence-based program called START from a program called Living Works, and it's a wonderful 1-hour training that teaches you exactly what to do when someone's not feeling right and there might be some depression or something's going on and you just feel something's not right, but you don't know what to say, you don't know what to do. Sometimes you don't say anything, but it's important that we learn that we do need to reach out, and there's a way to do that. It's an excellent training. Everyone who has taken the training has said positive things about it. And I've been in the field of mental health for almost 30 years now, and I liked it and I learned something from it. So please take advantage of that. You can go right to our website, go right to letstalkgenesee.com and request that training, request a license for that. So that's available. Please take us up on that. Also, of course, we have the National Suicide Prevention Lifeline, which is 800-273-TALK. That's available, again, 24/7, 365 days of the year. Also, there's a newer program and counseling line available called Michigan Stay Well Counseling Line. And that's also a counseling line for anyone in Michigan. It's not just Genesee County, anyone in Michigan. If you're having trouble, whether it's related to the pandemic or any kind of mental health concern at all, you can call that line and get resources, get support, get counseling. That's another great resource. This is something else I learned about, and I'm very pleased to hear about, a new initiative of a support group, a virtual support group for parents on Mondays at 4 p.m. It's called My Stay Well Support Group for Parents. And this is a Michigan sponsored program by MDHHS. And you can register for that program by going to michigan.gov/staywell. So keep that in mind, because that's another resources. I know parents have had such a hard time with all the fears and all the challenges of the pandemic and still returning to school and all of the challenges we've had with that, with all of the healthcare concerns and masks and changes. And it's just been a really hard time for parents and students through that process. So this is a great support group for parents. So please keep that in mind as well. So I just want to say, I know I've given you some kind of grim statistics about children and child trends, but please keep in mind that children are resilient and that we really can work together to help each other and to support each other. And there are many things we can do, not just to prevent suicide, but to be a support for people that we know, either professionally or personally, and get them linked to the resources. There probably are more resources now than there ever have been for children, families, and adults. So please keep that in mind. Also, prevention works. Earlier, the better. It's so important that we invest in strong families and communities and address poverty and resources and racial and health disparities. All of these things that we can do in the private, public sector, as community members, as concerned citizens, that works and it makes a difference. So it's so important to put our efforts into prevention. And I want to say that we know that resilience and recovery are possible. We know, we see it every day, and we see people healing and getting well and getting the supports they need. So please know that hope is always there. And there are a lot of effective programs and many, many services available. Please reach out and take advantage of some of these resources that are available. And if you have any questions, please reach out to us. My email is on here, kbaxter@genhs.org. I'm happy to take any questions that you may have and to help in any way I can at any time. And so I'll be happy to answer any questions you have during this webinar. Please put your questions in the chat, and I'll do my best to answer any I have, and then feel free to reach out to me at a later date. So thank you so much, Yvonne.
Thank you so much, Katie. I have a couple questions for you, and then we're going to ask our panel to come up for our roundtable. But Katie, one of the things that you talked about this, the resources that are available. Are these resources available in other languages as well, particularly in Spanish?
Yes, we do have lots of resources. We have a language line. So if somebody has a limited English proficiency, please reach out to us and we can help people with that. We've got materials that are printed in Spanish and even some other languages too. And also we have supports for deaf and hard and hearing populations. So yes, anyone with limited English proficiency, reach out for those services. And yes, we have available materials for them.
Thank you, Katie. One other thing, sometimes we talk about when we're talking about children and they're needing support, and you mentioned that many of them don't get in the supports as early as necessary. So a tip on helping parents acknowledge what might be a need to get some additional help. One of the things I was hearing was, oh, they're just having a bad day. But how often is this occurring? So what would you say, Katie?
What I would say is everybody has a bad day, right? All of us have a day where we feel a little down or something happens, we don't just feel right. That's normal, part of being human. But when it becomes an issue or a pattern, or it affects our life, if it affects our child's grades, it affects how they're having friendships, if they have a change of friends, they're not having friends. How are they doing in the community? Are they changing in behaviors? Are we seeing different kinds of behaviors? Are they withdrawing? So, one day people feel off, reach out. How are you doing today? And provide support to get through that. But if it's ongoing or it's affecting them in any kind of way, then we need to get help right away.
Thank you, Katie. And I'm going to ask Dr. Reynolds, Dr. Hackard, Dr. Wolford, if they would join us in this conversation. Dr. Hackard, I know you've been an advocate for children, and we give you, great kudos for the work that you've done to ensure that our children are going to be safe when they're going back to school. So I want to just provide you an opportunity to give us a quick update as it relates to what's happening with our children.
We are seeing our cases rise dramatically, particularly in children. The last couple, it's now like 2 days since I heard it. Time's so relative right now, but it was like 1 in 4 cases in the United States is a child. And the anecdotal evidence that I'm hearing from our school principals is that things that say lunchtime in a cafeteria, excuse me, lunchtime in a cafeteria, there was occasional transmission that you would see, but now it's actually significantly, the transmission of Delta is just as high in children as it is in adults, and that's what it has been really just, like wildfire going through our United States. And so I just want to take a moment to address that. There's just a few little modifications of orders that is to come out today. And one of the things, though, that in our school toolkit, and we've talked about it with the superintendents, and I know Ms. Hill was here, so that's nice to see her too, or Dr. Hill, and that we are going to be implementing test out options or testing options to keep children in school during a quarantine period, so that we were following the state guidelines with the exception of the at-home test. But now with the president's push to do at-home testing, which is a huge convenience, but there is the whole honor system necessity for that, then we are going to be trying to also include that in it as well. As before, we continue to monitor things. If something changes, such as this, test out option to stay in school during quarantine, and we see numbers increasing dramatically in schools that have implemented that compared to schools that have not implemented that, then we would, of course, address that and change it back to what we would need to do. So schools are going to be the deciding factors on if they are offering test out options or staying in school during quarantine with testing, and they will be administering it as well.
Thank you, Dr. Hackett. We'll be looking for that information that comes out from you a little bit later today. Want to also invite now Dr. Reynolds and Dr. Wolford. This is a really important topic. So I'm just going to let you pediatricians now just have your moment. Dr. Reynolds.
I don't know why my colleague, Dr. Wolford, is waiting for me to say something first, but so be it. In my own family, in the past week, a preschooler got a call that there was COVID in the classroom. Of course, it happened on a Friday, and perhaps they didn't hear till Saturday, but this little person was COVID positive. The important message here is know how your school is going to communicate with you should there be a positive test. Check your emails, texts, or answer the phone. It may be your health department, it may be your school, but make sure they have accurate contact information. Because if you have a child who's had a close contact in the classroom, you need to get tested. If you have a question, you and the child need to get tested at some point, especially if that child is symptomatic. But here's the problem. A lot of children are asymptomatic. They don't show any signs of disease. So take those calls seriously when you get a call from the health department or from the schools. Please, I'm talking to you from personal experience. So please follow up on those things. And then I'd like to talk about who should get tested. If you've traveled, you need to get tested. If you've been in a crowded building and you see people don't wear masks, or if people are shoulder to shoulder, you need to get tested. Because of my contact with a family member just this weekend, on a Saturday, I got myself tested on Thursday. I walked in and walked out within 5 minutes and got my test within an hour by text on my phone. So I'm trying to get the message across. Testing is available. People who can help you are available. If you can't hear or missed it, you can go to the health website and those resources are listed. But most important, stay in contact. And then unvaccinated family members. And just so you know, this is not just something that happens elsewhere. I have 2 adult children who refuse to get vaccinated, or they avoid the subject when I bring it up. And I tell them, as I told them last night, Christmas is coming. If you are not vaccinated by the time of Thanksgiving and Christmas, you are not invited to home. Don't bother coming. And I'm quite serious about this. And these are the things we have to start thinking about now. And I definitely enjoyed Katie Baxter's presentation on mental health, because as I told you last year around holiday season time, I had 2 family members, one who committed suicide, a young man, and one who attempted suicide, another young man, different branches of the family, different parts of the country. So this is real. We must stay in touch. And I think I'm going to take that updated suicide prevention training.
Thank you, Dr. Reynolds. Dr. Hackett, I see your hand, and
I did. I
No.
just had a question for you, Dr. Reynolds. Was it the so-called brain biopsy type of test, or do they do just the nares now for that?
They just did nasal swab, antigen, quick test. So if I have symptoms, I will be back for an RPR.
No, I think people need to know it's no longer where they're shoving it up so far that you think they can't go any farther, and then they do. And so that is a big deterrent when people have had one earlier, to know that that is not what they're doing anymore.
Yeah.
Yes,
Thank
thank you.
Thank you. Dr. Wolford, we got about 60 seconds.
60 seconds. I'm just going to emphasize what Katie said, that this mental health issue is incredibly important, that sometimes in certain populations, we don't really want to acknowledge it, and we think it affects our communities of color less often, but that is changing. We see suicide, though it's rare, even in 5 to 11-year-olds, and in that age group, the rates doubled in Black kids, and to surpass that in white children. So you really need to know it happens in our communities. We have to pay attention to kids' feelings and listen. I know when we often say, how you doing? And we're gone, we have to say, how are you doing? And listen. Feelings are a warning sign. If our smoke alarm goes off, we shouldn't just turn it off and go back to bed, right? We look for the fire. If kids are saying that if you ask them how they're feeling and they express some concerns, we have to get them treated. If we break our legs, we don't just keep walking on it and say it will get better. Mental health issues need just as much care and attention as the physical health as well, because they're both interrelated.
Thank you. Thank you, Dr. Reynolds, Dr. Hacker, Dr. Wolford, Katie, and Tricia. Thank you all so much for the wonderful information that you shared. And it's so important. Dr. Reynolds, and you mentioned getting tested and knowing where we can get vaccinated. This is why it's so important that we hear from our health department every week. Sherelle Brown is here with us, who's going to share with us the updates from the health department and give us some very, very important information today. Sherelle.
Good afternoon. Thank you for having me again this week. So I do want to start off by stating that Dr. Hacker did implement the mask mandate for pre-K through 12, and that will be in effect until we see a moderate transmission within our community for 14 consecutive days, which brings me to information of how we're doing in the community. In the past week, our trend of new cases did decrease. However, our transmission rate is still very high according to the CDC's guidelines. So we want to continue testing our children now that they're back in school, and getting tested if you've been in large crowds or a close contact to someone who has tested positive for COVID-19. Throughout the community, at almost 340,000 first doses have been administered in Genesee County of the COVID-19 vaccine, which is great considering we have a population of a little over 400,000. So we are making strides to get as many people vaccinated as possible. We want to see our positivity rate go down. Right now it is at 10.4%, which is not the lowest. So we ask that you come out to some of our sites if you have not been vaccinated to receive your vaccine. And upcoming will be at Our Lady of Guadalupe Church, as well as Central Church of the Nazarene and Shiloh Missionary Baptist Church, Tuesday, Wednesday, and Thursday, which are our standing clinics every week. So we'll always be at those locations from the times on your screen: Tuesday 12 to 2, and we'll have Moderna and Pfizer. At Our Lady of Guadalupe, Wednesday 10 to 12, we'll have Pfizer and Johnson & Johnson. And then on Thursdays from 3 to 6 p.m. for those who can't make our earlier in the day appointments. We're always at we have and Thursday over the weekend, as well as First Trinity Missionary Baptist Church will be Church of God, as well as Nails Academy. So patient here 10 to 2 at U of M, as well as First Trinity, and then from 9 to 11 at New Creation Church of God, and then later on from 4 to 6 p.m. the Brownell Home STEM Academy. And I did want to mention another pop-up clinic we'll have next Wednesday. There's a veteran stand down event happening at the Chevy Commons area on North Chevrolet. And from 2:30 to 4:30, you can come out and get your vaccine. We will offer all 3 vaccines at that location. Next slide. Next slide. And because we are in high transmission in Genesee County, we do encourage you to continue getting tested. We have our same centers as always located within the community where you can get a free COVID-19 test, and you can visit Word of Life Church, Bethel United Methodist Church, as well as Macedonia Baptist Church. Some of those clinics also offer the vaccine. So kill 2 birds with 1 stone. Visit your local Rite Aid, Walgreens, or our Hamilton Community Health Center. And if you are homebound, you can reach out to the health department by calling us at 810-344-4800. We have registered nurses who will visit your home and come get you vaccinated. So you can join the rest of us in keeping yourself protected and healthy. I did want to say something else. So as you all know, we are doing a 3rd dose for our immunocompromised individuals. 3rd dose and booster dose are 2 different things. Booster dose has not been given a date to launch. So right now we're doing 3rd doses for those who have a decreased immune system so that we can get them up to where a healthy person of the general population would be. So those who have different things wrong with their health that causes them to be immunosuppressed, they are eligible for a 3rd dose. And then 8 months from their 3rd dose, they can also receive a booster dose. And the booster dose is a maintenance dose. It is not the same as 3rd dose, which is only being offered to our immunosuppressed individuals at this time.
So Cheryl, I wanted to stay right there for a minute because I want you to sort of go over this and let's do it a little bit slower. There are people now who can get the 3rd dose of the Moderna and the Pfizer. Okay.
Correct.
So when you say immune compromised, do they need, when they go to an open clinic in community, do they need something from their doctor to confirm that they're immune compromised? Or how will that work?
They do not need anything from their doctor. We'll go over their health history with them and any medications that they might take. But right now we want it to be barrier-free. We will, consult with you to make sure that you fall in that category. And if you do, by any means necessary, we're going to give you that 3rd dose of vaccine.
Okay. And so now go ahead.
And I was just going to say, and also if you received Moderna for your 1st and 2nd, you're going to get Moderna for your 3rd. And then if you receive Pfizer for your 1st and 2nd, you'll get Pfizer for your 3rd.
Okay. So what is the guidance on the J&J or the Johnson & Johnson? As far as the 3rd, has that been approved?
Currently, it has not been approved for another dose, but I believe that they are working to get approval for that manufacturer as well.
Okay. So what's wonderful about this is that the health department, along with the other partners, because we do have Hamilton that's also giving out vaccines, as well as the Genesee Community Health Center, they're willing to work with community. So really go to these sites and ask your questions. For those of you that are on, I know we have community health workers and social workers, you're helping us to get this information out to individuals who may not be able to join us in the webinar. So please, that's why we ask you, if you're hearing questions in community that can be answered here, please put those questions in and allow us to help you have the information you need to support getting the information to our community. So thank you for that insight, Sherelle. We appreciate you. We're gonna now talk to Mary Catherine Crawford, who is a public health practitioner working at the Flint Center for Health Equity Solutions. Mary Catherine.
Thank you. Always happy to be here. So we have quite a bit of stuff to get through today. So I'm just going to go ahead and kick right off. So I really want to drill down on why everything Sherelle talked about is so important, right? As we start to get into trends at this point in the webinar. So the first thing I want to just say is that this is now the 10th consecutive week that we've seen cases increase. And then if we take a look at cases by race, remember when we have these surges, our ability to monitor disparities is totally skewed by lags in data. And you see that quantified in those gray boxes on the screen. And then especially the incomplete data, when we don't have race or ethnicity information for people, that's denoted by those red boxes that you'll see in the key. So again, when we don't get these cases reported or the data reported comprehensively to the health department from our laboratories, we have a problem, right? That being said, the data that we do have, it doesn't appear that disparities are reemerging right now, but as always, we'll continue to stay on top of this. So if we look at the rates by municipality, though, we continue to unveil some patterns that we wouldn't necessarily be seeing with just with countywide data alone. And what you'll notice is the magnitude of cases has really just exploded since the last time we've been able to provide this data to you, which was in July. In July, the county had a total of 285 cases. In August, that number was jumped to more than 1,400 cases. So this is not insignificant. And I just want to add a little bit of context to this. If I draw your attention to the first municipality on the top, that's Fenton Township, that's a 7-fold increase from July to August. And then if you go nearly practically all the way down to 7th from the bottom, and you'll see that red box where Flint is highlighted, that they had about a 4-fold increase from July to August. So it's always just so important. We remind you about this to always take a peek at the data in different ways. So if we move on to the next slide, you'll see July juxtaposed with August when it comes to geographic spread. And this just really helps to illustrate the point I made about the explosion in cases from July to August. It just really helps to illustrate that we need to be doing better as we move into fall, right? As it gets colder and drier, we're indoor more, right? So we need to collectively work together to stop heading in the wrong direction. This is definitely nothing to take lightly, as our other presenters have indicated. So I'm going to leave you with that and then transition right into policy. So there are 2 pieces of legislation that I'm really excited about because it's a bipartisan effort to address what is known as period poverty. And that is new to some people. So let me just provide a little bit of background. Period poverty is a pretty common term used to describe one's inability to afford feminine hygiene products. And this is really a prevailing problem that many people are not aware of. And it's here right at home and across the United States. And so the inability to afford such products really lead to inadequate access to the products that result in people missing work, school, other opportunities. And then not only that, there are major health consequences like on women's mental health. So the 2 pieces of legislation aim to ban taxes on these essential products. And this is really an important first step in improving access to them. And it's also a really important indicator of women's equity. And with that, I want to move on to our next piece, which is mandate equity. So I'm sure most people have been following what's been going on when it comes to the attack on women's rights for abortion. We know that Texas has cleared a path for Roe v. Wade to be overturned. And in the Michigan legislature, there's a bill to repeal a 1930s law that is currently still on the books in Michigan, just superseded by Roe v. Wade. And so if Roe v. Wade is overturned, at some point, it's possible that this law would actually go back into effect. And this law actually makes it a felony for anyone to aid in the termination of a pregnancy or induction of a miscarriage. And while this affects women everywhere, the impact of Roe being overturned and then this archaic law going back into play is going to disproportionately impact minority women. And that's because, as we see with many other health issues and outcomes, racial and ethnic disparities are prevalent in abortion rates, right? They're directly related to disparities in rates of unintended pregnancies experienced by minority groups. And so you might ask, well, why does this happen? Well, it's just like other health issues. Minority women are more likely to encounter barriers to abortion services and other reproductive health services. So we hope and advocate that our policymakers here in Michigan preserve the rights of women and prevent disparities from widening any further. That's what I have for today.
Thank you so much, Mary Catherine. And we want to encourage everybody, there's more details in the policy brief. Please be sure that you subscribe to that brief so you can get that information. We're working to bring you information that you can have to be able to make some informed decisions. So thank you so much, Mary Catherine. We now want to get an update from the city of Flint. Kiana, we welcome you today, the manager of our public health for the city of Flint. Welcome.
Thank you. Good afternoon, everybody. I won't be before you very long today. Just a few updates from the city of Flint, beginning with the Office of Public Health has partnered with Hamilton to offer vaccinations here at City Hall, just outside City Hall, and that is going to take place on September 14th from 9 a.m. until noon. September 14th, 9 a.m. until noon. Of course, if there are any questions, you can always call our information desk. That number is 810-410-2020. And just a few more updates from the city. There is an ongoing bi-weekly public safety update that gets posted to the City of Flint's website. This bi-weekly update for this week includes updates on the mini stations, as well as traffic response from the Flint Police Department. So if you have an opportunity, please go ahead and look at the City of Flint's website at that bi-weekly public safety update. The mayor has wrapped up his ward by ward tour. There was good response there, and the mayor's office is looking to kick that off in the fall again with even more engagement with the community, and also partnering with businesses and community groups to participate in that ward by ward tour. So residents, please look for that on the City of Flint's Facebook page and other social medias and the website. And then finally, I just lost my thought. The Office of Public Health, I'm back. The Office of Public Health navigators are continuing to be present at the help centers on Monday, Tuesday, Thursday. So that's Monday at Bethel, Tuesday at Asbury, and Thursdays at Greater Holy Temple. And they have supplies, including the zero pitchers, as I mentioned last week, as well as filters and cartridge replacements. So if there are residents who are still looking for water filtration systems or cartridge replacements, please feel free to show up at the help centers, or you're welcome to come into City Hall at the information desk for those materials. And that's all I have for today. Thank you.
Thank you so much, Kiana. We appreciate those updates from the city, knowing that there is opportunities, information, and resources that continue to be available as it relates to the water crisis, which is ongoing for us here in the community. We want to thank you for joining us today for this webinar. We hope that the information was helpful to you. We're glad that you put in the Q&A that some of the information shared last week. Dr. Johnson, you said you showed that match test to some in the community. We appreciate that. And we certainly hope that you will continue to help us get this word out. For those of you that are social workers and community health workers, please continue to register for those contact hours in the CEUs. Our hope is that this will be greatly beneficial to you. We're also going to ask you to continue to join us, like us on Facebook, and subscribe to our YouTube channel at Healthy Flint, and feel free at any time to email us with the questions that you may have at info@hfrcc.org. We also encourage you to please give us a call at 810-835-2130 so we can be sure to be responsive to you. And we look forward to you joining us again next week for the Flint Community Webinar on coronavirus. Thank you so much for joining us. Be safe.